Good evening and welcome to this interview in the Elephants series on the COVID-19 pandemic. This evening, I'm really privileged and honored to have with me Dr. Chambi Chachage, who is Tanzanian, and he is a scholar of African studies, specialized in studying the development of Dar es Salaam and the elites in Dar es Salaam, and is currently at Princeton in New Jersey. So I'm very happy to be speaking to him at this time. Asante sana daktari na karibu.
Asante sana, asante.
Asante. Kwanza ningetaka kuuliza, I wanted to ask, how are you doing? What is lockdown like in Princeton? And how's the family and,
So I'm generally doing fine at the moment. I'm living by myself alone in Princeton. I left Dar es Salaam in late January to come to the US, where I'm based temporarily to the end of the year. So the lockdown here, I think it has been handled very well by the governor of New Jersey, Governor Murphy. He has been issuing a number of executive orders that are posted in the official website with a lot of clear guidelines about how to handle the lockdown, and it went step by step. So it just didn't start by like closing everything. So there's some places that have been open, that were open, and they're still open. The place for essential products such as food, as well as medicine. So basically, in my case, I opted to always be staying inside, but I always go outside at least once per week on Friday to go and buy some vegetables because I'm a vegetarian. So I rely more on fresh produce, but of course I also put some dried food in the case where even that store, that shop end up being closed. At least I can still be able to survive until I get some product from either online or some far off places.
Yeah. Thank you. Daktari, if you can, your scholarship is on the development of the city of Dar es Salaam and the development, and the elites that have emerged there. And the current model of city in much of Africa is what we inherited from the colonial regimes that were here. Obviously, we look at what's happening in America and in the West. These cities have been hard hit by COVID-19. And that forces a bit of reflection about what constitutes a humane city, especially for Africans who are very communitarian kind of people, very the social interactions and relationships are very important. I was wondering whether we can start with that and using the background of the work that you did in Dar es Salaam.
So historically, if you look at Dar es Salaam, it didn't really start as what you may call a Western city or a modern Western city. It was initially started by the Sultan of Zanzibar, Sultan Majid, in the 1860s. But of course, the Sultan was also influenced by other architectural currents of the time, drawn from all over the world, whether it's from Asia, from Europe, and other places. And he focused on the coastal side of Dar es Salaam. But later on, Tanzania, Tanganyika, and Dar es Salaam in general became colonized. When it became colonized, it became segregated into three racial spaces. So the space for what we call Europeans or Wazungu, Uzunguni, the Uzungu side, the place for people of Asian descent, what we call in Tanzania Wahindi, and the area called Windini, and then the place for African or the Swahili side. And there was a place in between that was created as an open space, almost like a no man's land, drawn from some of the theories of hygiene of the time, trying to protect people from the spread of disease. And of course, it was a racialized policy. That space is called a cordon sanitaire, and you can see from sanitaire, that's where you get the word sanitarium.
Yes.
So it's all about making sure that the disease, especially from the so-called blacks or Africans, don't cross to the other side. And throughout the Dar es Salaam history, that separation or that segregation has not completely been done away with. And one of the reasons is because the Uzunguni side, which was more or less developed than other areas, became the sites for elites after independence. And not only the African elites, but those are the areas where the ambassadors, the members of the international community ended up living. And then the Indian side, it continued to have Indians. And of course, there was some movement. Even during the colonial times, it was not like black and white, exactly black and white. There were some moments where people moved in between. But at the end of the day, it was more or less a city of 3 zones. And I think that has a lot of impact even in the way the city is dealing with the current pandemic. Because what some of us think is a hotspot based on the anecdotal evidence we have or the anecdotal statistic we have in Dar es Salaam is a place called Kariakoo, which is a center. Basically, it's a center, the central market for virtually the whole country generally. It's a case where almost all roads lead to Kariakoo.
Yes.
In the morning, where people bring their foodstuff, food products from peri-urban and even rural areas. People come and buy their products. And of course, you have some other satellite markets, but that's one of the major one. And it's very close to the central business district, which is close on the side which was Uzunguni, and Kariakoo is more connected to the side which was Uhindini. And as you know, historically, people of Asian descent were the dominant in business and trade in East Africa, generally Kenya, Tanzania, and even Uganda to some extent.
It's, talking about the COVID-19 pandemic and its impact on Tanzania, before we go into detail about it, just before I forget, there's a lot of discussion about what works. We don't have a vaccine. This vaccine is many months away. The quickest a vaccine has ever been developed was the mumps vaccine, and that took 4 years to do. Maybe now with all the technology and the global coming together to deal with it, I think that maybe it will move a bit quicker. But without a vaccine or serious treatment regime being developed, obviously we're using these mitigation measures of lockdown, physical distancing, testing, etc. But Tanzania has some experience with alternative methods of treating illness. Can perhaps you can tell us a bit? I mean, for a while, I think 2013, 2010, or 20, I can't remember the exact time, when there was a lot of excitement about a herbal remedy that had been found in a place called Loliondo in Tanzania, and wondering whether you can reflect on that a little bit in light of the current pandemic and the fact that in Tanzania the government is doing research into a similar kind of drink or compound herbal treatment that has come from Madagascar.
So, so I had the privilege or the opportunity to cover the Loliondo story because I traveled there, interviewed Babu Loliondo and some of the elders there, and I wrote a couple of articles in the newspaper, The Citizen, Mwananchi, and the Udadisi blog. But before I talk about Loliondo, I want to go back to your initial statement about the experience we've had with herbal alternative medications. And this is not just a Tanzanian phenomenon. It's a continent-wide phenomenon because we have rich culture with a very long history of practicing and dealing with herbal medication. Like I grew up being given those alternative kind of medication because I had problem with asthma in my chest in my grandma village in the northern part of Tanzania. So we had at least 3 or 4 kind of herbs that were around there. I even remember their name. One was called Mwache, the other one was called Muodo. So it's something that is very common. Now, the challenge that we normally face in Tanzania and other places is a thin line that seems to be there between traditional medicine and what people call witchcraft and so forth. So sometimes it's very difficult to separate the two.
Yes.
And if you follow, for instance, the issue of the albino killing in Tanzania, it actually made the government even come with some very strong measures against virtually all traditional herbalists or traditional healer. They've got so many names, and part of it was trying to control that because it seemed to be difficult to separate those two. So I think that's important because this other tradition, the tradition of using alternative medicine, whether it's food or plants or just herbs, is a very long tradition. And it has gone hand in hand with modern practice. So in as much as I was given those alternative medication, I was still sent to the hospital. I was still given chloroquine when I had malaria and so forth. So when the Loliondo moment came, what I normally call it Loliondo moment, when it came, it was a combination of all this tradition. So there was a combination of the traditional herb because Babu Loliondo picked a particular tree that was already used by the Maasai, because I interviewed some Maasai, they said they were using it to treat a certain disease, I think in cattle and humans. The elders there also told me they use it to treat what they thought was cancer in animals. So it's something that was already there. It just didn't pick a random tree.
Correct.
So for me, when I was investigating, it told me that this tree already has medicinal value. And I remember I asked my sister, she's a molecular biologist and biotechnologist, Dr Chambi Chachage, to at least write some kind of an article on it. And she wrote an article which analyzed a study, which was more or less a literature review done by a team that was sent by the government. And they concluded that indeed that particular tree had some medicinal value. Some people were already researching it. There were a couple of papers that were working on it. So if you use something that already has some elements of medicine,
yes,
it will have some sort of effect. And that's what I felt was happening in Loliondo. On top of that, then there was a religious dimension.
Yes.
Because that was a retired pastor. So, yeah. And we are very religious people, we can't doubt that because of what we call the triple heritage of the Islamic tradition, the Christian tradition, and our own African religious tradition. So you have the spirituality coming, you are having the herbal side, the medicinal side of the tree, and then you have the politicization. Like we had all these government ministers going there, drinking from the cup of Babu Loliondo, and then you had the media, another fourth aspect. The media, the new media, the social media, advertising it, publicizing it, and then you're having all these buses, even helicopters. Buses coming from Uganda, from Kenya, helicopters coming to bring from this cup. So coming back, fast forwarding to the current time, And then you are having the Madagascar portion, whether they call it a portion or a medicine. They have a nice, the Madagascan president, he's an expert in marketing. Yeah, so he has really branded it very nicely. We have to give him credit. It's a COVID organic. Even the name, the kind of bottle that he's using. And he's also using more or less like the Babwaluliondo strategy. It's a particular tree that has a medicinal element in it. So for some people who are coming from all these traditions, it's not easy to dismiss this. And that's why some people are saying, let's give it a chance. Let's give it a chance. Let's do some trial. And then there are some people who, once bitten, always scared. For them, all they remember is that this is like Loliondo again. We can't go into this line. So if you ask me, my personal view is that if something has indeed a medicinal element in it, scientifically, it has to be given a chance, especially at the moment where you don't have alternative. You don't yet have a vaccine or a proper medication to treat it. And another interesting aspect into that, which is something I've been closely thinking about, because at the moment in Tanzania now, there are a lot of people who are trying to come up with their own traditional herbal medication, claiming that they can either relieve some of the symptoms, COVID-19 symptoms. They want them, the state agency that is responsible for researching them, to go and do some trial on them, is the fact that respiratory kind of diseases that have to do with coughing and sneezing, are among the diseases that have a lot of these alternative medications. Correct. And we've been using them all the time.
That is true.
Whether it's tangawizi, ginger, whether it's lemon, whether it's honey, whether it's those traditional herbs I mentioned earlier on from my grandmother's place. Almost every African community in Tanzania have their own type of medication. So in this context, definitely, if you are telling people part of COVID is coughing, is sneezing, and they know something that can relieve sneezing, coughing, definitely they are going to use it.
Correct.
Just like they've been using it before.
Correct.
What matters is now, how do you really progress from that point and try now to, and people are already doing that. One professor called Professor Malebo has come up with something. They are claiming that they are doing some trial on it. But when you look at the ingredient, it's a combination of more or less the same kind of ingredient that we've been using all this time. So maybe what matters now is how do you come with a dosage that you are going to subject to a scientific trial, a scientific clinical trial, that will actually prove scientifically that, if you take this, maybe indeed it's going to reduce sneezing. Maybe indeed it's going to build your immunity. Maybe indeed it's going to reduce blood clotting, because there's another theory or argument that is claiming that blood clotting is also part of this COVID-19 symptoms. So yes, that's my take on that.
Okay, that's very, very interesting. One has to admit there has been a lot of debate and some controversy when you look across the continent at the reactions, the responses that governments have applied to the COVID-19 pandemic. And Tanzania has adopted an approach which people have likened to the one in Sweden, of herd immunity. But that is not what has been articulated by the senior officials in Tanzania. I think the Tanzanian border with Zambia was closed recently, partly as a result of this mismatch in policies between neighboring countries in eastern and but now part of Southern Africa. And I wanted you to comment about, Tanzania's approach to the fight against COVID-19, and what are its key elements. And I said some controversy has been generated by it, and I'll be keen on your reflections on that.
So I'll address that in two parts or two ways. The one about borders, I would like to talk about it a little bit more later, because it connects to something that is very close to me, the ideas of Pan-Africanism and unity. And normally it takes a long time to talk about it. So I'll start with the other part. So the first part is, in a way, it's unfortunate because the discussion and debate about Tanzania is happening at a time when you already had a political atmosphere that already wanted this moment.
Uh-huh.
So okay, let me clarify. So what I mean is, even before the coronavirus, you had a very critical atmosphere against, like, the current president of
Yes.
Tanzania, especially in the international media.
Yes.
So this almost became an opportunity to continue with that critique in a more enhanced manner.
Uh-huh.
And I think, as a scholar, as a critic, as an activist, maybe to some extent, I think it's an important conversation.
Yes.
But because it's so polarized, it makes it very difficult to really at least try to look at this, what is happening, at least objectively, try to make sense of what is happening.
Yes.
And to a significant extent, I think it's also a product of the style that the president has been consistent in his leadership, in his form of leadership, because he seems to have at least two styles or two approach. One seems to be very consistent.
Yes.
And I remember there was a time even Kenyans wanted him to be,
Yes.
be their president, and now
Yes.
it seems a lot of them have changed gears. But so there's that consistent, and then there's some other aspect that seems to be inconsistent to a lot of people.
Yes.
So I start to address with what I see to be, what I perceive to be the consistent style of the current president of Tanzania. So he has been very consistent in sharing a lot of information, which are in line with what he wants to be shared. And I know we might argue that it's a product or an outcome of the social media revolution in Africa. But the social media revolution in Africa, as far as I know, predates him.
Yes.
Like, we had Twitter and Facebook and blogs during the previous regime, and the president from the previous regime in Tanzania even had a Twitter account. They had all these websites that they were trying to share information. But from my own, I haven't done a systematic study, but from my own observation, the current president or his regime has been issuing a lot of press release, even long, sometimes 2 pages, talking about this meeting, talking about that. He's been airing a lot of live sessions. So there's a lot of consistent in feeding us information, but it's information customized, I think, according to his ideas and his interests in the way he wants to run the country. And then there's the other side, which is the one that is at the core or the heart of all this criticism that we are hearing or reading, is the fact that there's some information that people think are relevant to them, and then they don't seem to get them. And that's what they want.
Yes.
And as I said, this is consistent, so it predates the corona times. So there's some information about the budgeting, the budgeting and the use of certain certain money in the government, whether it's the money to buy aeroplanes, airplanes, and so forth. People were like asking and asking, we need this information, we need this information. People wanted the parliament to be live. I mean, there was a time they decided the parliament won't be live, and then the parliament ended up not being live. So there some people wanted that kind of information.
Yes.
But at the same time, back to the consistent part, we are also being fed all this important information, whether it's the president's speech, whether the president's opening something, you are getting a lot of information, but these are the information that you don't want. So when you get to the COVID-19 situation, it's a continuation of that style, where people on March 26, when the ministry responsible for health came with these statistics, they had the number of samples that were taken. That was about a couple of weeks after our first incident. Remember the number, it was 273. And then suddenly after that, we are not told about the number of samples that were taken for the testing. You're only given the number of cases and the number of deaths and the number of contact tracing, which are important information. Very detailed. This is the number of people we've been tracing. This is the number of people in quarantine. This is the number of people who have recovered and so forth. But people want that number of samples.
Yeah.
Just like the way they wanted to know about how much money was used to buy, budgeted or bought to buy the aeroplanes, and they want the audit for it. It's the same kind of thing. So at the end of the day, you end up being in some sort of like two camps or two parts locking horns. One part feel is already giving you a lot of information, important information.
Yes.
And we're using it. It doesn't mean that we don't use it. We use all this information, we do all these things. But then what about this other thing? You see? And the international media keeps picking up on that, to the extent that all these other things that seems to be standard procedures of addressing the COVID-19 don't become part of the major narrative.
Yes.
So for instance, the schools were closed in Tanzania. No doubt, they were closed. The universities were closed. People from the, and then later on we closed like the international flights. But even before we closed the international flight, people who arrived, they used to be isolated, 14 days. So there were so many measures that were taken, but because there was these other things that we really wanted, including myself, very religious, I think, and spiritual. I go to church, but in my church here, since the very beginning, we've been doing online worship.
Yes.
So we expected that maybe it's important that we close the mosque, we close the churches. So when the president comes with those statements about the church and the mosque, that's become the core of the story, not about the schools that were closed, not about the 14 days quarantines for people who have arrived in Tanzania. And then when he came with a controversial argument about the lockdown, again, people zeroed it on it. And the irony is the very people who are critical of the lockdown sometimes are the very people who are also, the very people who are critical of Tanzania or the current president of Tanzania not wanting a lockdown are more or less some of them are the same people who are critical of the way the lockdown is being done in South Africa, and the curfew in Kenya, and the violence of the state. And then you wonder if the current president with all this international highlight on him, the current president of Tanzania, if he has really done the lockdown according to his style. Yes. What they call the bulldozing style. If he has really done that bulldozing style, most likely it will have been also heavy criticism. So let me just pause for a moment there and say, so because of that consistent in a certain style and inconsistent in a certain style, it becomes very difficult for people now to figure out what's happening. Because in the absence of all this data that we need or information that we need, people are starting to just guess, okay, maybe this is herd immunity, maybe this is that. But you also have some other voices that are saying it's possible that the president at the end of the day might be vindicated because people now are starting to ease the lockdown. So in a way, in other countries.
Yes.
People tend to ease the lockdown, but in Tanzania somehow it seems the decision was to try to manage life, to balance the economy and the health, even though we don't really know to what extent we balance that, because we don't have the data. We don't have the public data about to what extent people have died, to what extent people have been diagnosed with COVID. So we don't know that. We're just doing a guesswork. But it is quite possible, if we had indeed done the lockdown at like a total lockdown, things would have been very worse economical to a certain number of people. Now, if you come back to me at the personal level, my own personal position is that because of the polarization of the debate, we end up being stuck between total lockdown and no lockdown. But there's something in between. There's something in between. You can have some certain measure of dealing, especially with what we call hotspot, which most of the time are the cities, the major cities. And if you look at the numbers in Kenya, for instance, the number is Nairobi, Mombasa. That's why they had to have there was some sort of a special intervention in those places.
That's
so
right.
For some of us, we expected there will be some sort of a special intervention in Dar es Salaam.
Okay.
And maybe Dodoma because of the parliament and the political activities, and maybe Mwanza because of the Lake Victoria. It's a regional hub there. And it doesn't have to be a total lockdown, because there's some people, again, because of the class issues in Tanzania, there's some people who can easily stay home and some who cannot stay home. So if there was some sort of a partial lockdown, then it means some of those people who were capable of staying indoors will have stayed indoors, which in itself would have been helpful, because if a city is about 5 million people, if you can even manage to remove 1 million out of the street, it's quite something, because it's like a number game. It's not like nobody gets it 100. It's not like 100% or 0%.
Yes.
It's somewhere. So you just have to move the number to the positive side as much as you can, to the better side as much as you can, because nobody as far as I know from the statistics that I'm looking, nobody has got it 100% perfect. So that's what I would say. And if I go back to the issue of Sweden, I've been following the debate. I have some of my relatives in Sweden. I've talked to them. I've listened to the interview by their chief epidemiologist. And one of the major differences is that they are transparent about the strategy. It is well known. It is led by their expert. It seems to be consistent. We might criticize the approach, but it seems to be scientifically based, at least. Because even in science, their perspective, sometimes we tend to think perspectives are only in social sciences and humanity, but even in sciences, their perspectives. So he decided to take that particular perspective in science. Somehow it seems that his status supported him more or less. In a way, people have been going on trying to put more responsibility on themselves rather than the state. In our situation, if I take the example of Tanzania or Dar es Salaam, yes, there are a lot of people who have also taken a lot of personal initiative to protect themselves. But again, because of that tug of war between the consistency and the inconsistency, the lack of transparency and transparency in certain aspects, being fed with a lot of information on one side and being denied certain information on the other side, we don't seem to have that broad, clear-cut strategy to make like a conclusive statement that indeed in Tanzania, our approach, our strategy overall is this. But if you scratch the surface, you can see it's a potpourri of all these many things.
Yeah. The regional leaders have clearly been talking, and the person who has been most proactive in his communication has been the Ugandan president Museveni. He's on TV a lot. He does long interviews, issues long statements. He even does press ups for to show Tanzanians, to Ugandans and Africans generally that you can exercise in your home. He made a statement over a week ago now that actually God ordained East Africa to be one, and he described Kenya and Tanzania as the living room, and Uganda, Rwanda, Congo as the bedrooms, and that you cannot manage, especially under a pandemic like this one, we cannot manage each bedroom separately under with a team running each bedroom with its own rules. That if you're going to deal with this pandemic, you must have a coherent strategy amongst all of you for managing this house, because to get to the bedroom, you must pass through the sitting rooms of Kenya and Tanzania, so this is an issue which obviously has caused quite some debate because of the mismatch in approaches between Tanzania and the other countries within the East African community. And so the question I would put to you is what merit you see in this approach of that is being suggested by the Ugandan president Museveni, that actually COVID-19 calls for deeper cooperation and integration in East Africa. And I can see that you have in your background the newly published biography of Mwalimu Julius Nyerere, and he is the godfather of African unity, at least for many of us in East Africa and all the way into South Africa. And I was wondering whether you can comment on that, the fact that Tanzania seems to be charting a course vis-a-vis COVID that is ironically inimical to regional integration. And Tanzania has always been, actually from the 60s, has been the leader when others were looking to go alone. Tanzania was the staunch Pan-Africanist bastion in the whole of East Africa, even hosting African National Congress rebels. You hosted also the freedom fighters from Uganda and a whole host of other countries. And so intellectually, politically, militarily, Tanzania was had the most proactive, positive attitude towards integration. COVID-19 appears to have disrupted that, along with disrupting so many other things.
Yeah, so I have different angles in answering these questions, and I'll try my best to use all of them briefly. So the first angle will have to do with the controversial speech from our president from a couple of weeks back. In that speech, there were at least three things that he said, which I think in a way gives a glimpse of his vision in terms of the approach. So in one of the statement, and I'm paraphrasing because it was a Swahili speech, I'm just paraphrasing. So in one of the statement, he said there's a possibility that we are going to have this disease for quite some time. And I've heard that even that same statement from some scientists. I don't know whether he listened to them or read their work, or maybe it was his own reflection. And he used the analogy of HIV/AIDS and many other things. And you could see that in his head, it was almost as if he's thinking that we somehow need to find ways of knowing how we are going to live with this disease for quite some time, especially in the absence of a vaccine and a cure. And then another statement, which was a repetition of what he has said earlier on, is about the importance of African countries or countries in the developing world to come up with some sort of a consensus in relation to these international financial institutions and the donor community, in terms of making sure you're not getting into debts, to make sure that maybe we get grants more than getting credit facilities. And the third one there was a line where he said he critiqued or criticized or critiqued copy and paste.
Yeah.
Like copying and pasting.
Yes.
Especially when he was reiterating his position or stance on not closing Dar es Salaam, given that Dar es Salaam is really the heart of the country, the heartbeat of the country. So I just wanted to put that on the table, because I'll be coming back to them when I'm talking about this other thing, these other angles. So the other situation is that if you look again at what I said earlier on, is that you already had an atmosphere or a situation that COVID did not disrupt really, but it just came to enhance. Remember, when I was talking about the international community criticism of our current president, and then you are getting this situation, and then you are just getting more of a platform to criticize him more.
Yes.
Than you were even criticizing him before. So it's the same with the East African community. Our situation was already shaking, even before him. If you can recall the situation of the coalition of the willing on this side, and the coalition of the not so willing. And then you had some kind of factions in between. Sometimes they shift, sometimes it's one president being a friend of another president of one of the East African countries, sometimes they shift. So there are all these dynamics that were already causing a major crack in the East African community, even before COVID-19. So when the coronavirus comes, it just goes, the way I see it, to superimpose itself in this already conducive environment for the officials. And yes, Tanzania seemed to be the culprit because, again, of two main things. Because as I said earlier on, there's so many things that we've done that everybody does. The closing of school, the washing of our hands, we're even wearing masks now, probably even more than here. Where I am. In Tanzania, they're wearing masks more than here. Every time I go outside, there's so many people who are not wearing masks, you see? So there's so many things we're doing, and they're scientific, some of them maybe not so scientific, but they are done almost as a standard, almost everywhere. But there are two things. So the first one is a mass testing.
Yes.
The mass testing in relation to the not announcing of all this status or state of how many people have we actually tested.
Yeah.
And then the second one is the lockdown thing that I've talked about. Now, the mass testing caused a lot of problems because of the borders.
Yes.
Because indeed, we are the one in East Africa with a huge chunk of the Indian Ocean. So a lot of countries on the other side depend on us, whether it's Rwanda, Uganda, as well as other countries that are not considered East African. And that's something I'll also need to talk about, the crisis of identity, Tanzania's crisis of identity between being in the South and being in the East. Meaning East Africa, at the same time you are part of the Southern Africa. But back again to this issue of the borders. So when you get all these tests that are done on the borders by your neighboring country, and they're getting these numbers of drivers with COVID-19, it tells you, or it gives you an indication that there are a lot of cases in Tanzania that are undetected because of a lack of mass testing. And on our side, we can't really know because nobody has told us how many they've tested, how many they tested in the borders, in the border towns, in the border cities. We don't know. Maybe the people in the state, the government knows, but we don't have that information. But for those who have studied statistics, sometimes you can guess things based on proxies. So that is almost like a proxy for your estimation that if they indeed found this number of drivers, most likely there's a higher number somewhere else inside Tanzania. And that brings me back again to the initial statement that I started with the president, his initial statement, that you could see some indication of a quest, whether it was political or not, but a quest for some joint voice about the economy in Africa, how to deal with the economy in relation to COVID, in relation to deaths, because this is almost like a second major shock that we are going through as a continent. I mean, I'm speaking economically, because in economy, they have these shocks heavy shocks that hits you and then you have to bounce back. So almost every country has experienced their own little shocks here, but the major one that affects almost everybody in Africa is a shock we had in the so-called lost decade, when almost all countries, African countries, were suffering economically. And then almost all of us had a more or less similar prescription. And a lot of people suffered.
The structural adjustment from the 80s through to the 90s.
Mm-hmm. And somehow we've been recovering overall. Of course, you have some other countries that have their own shocks, whether it's civil wars and so forth. But as a continent, we've been in the process of recovering from that suffering, that shock and suffering.
Yes.
And it affected the public health sector, the education sector, it affected almost everything. So we are now having another major shock.
Yes.
And now when you are listening closely to the president,
yes,
at least when you try to take a step back and say, okay, yes, we have all these critiques justified, but let's put them aside and try to understand what is it really trying to say, or what is really trying to arrive at. Even if we think it's faulty, but let's just try to understand. And then you are listening. Oh, the economy. If I close the economy, if I close the borders, we have all these countries that are depending on us. And I'm looking at the citizen today. The citizen today, they're saying the closure of the Zambian border is $1.5 billion loss. I don't know. I haven't yet read it, but I don't know whether it's for how long. But that's the estimate. Because that borders connects all the way to DRC, it connects all the way to Zimbabwe and all these other places.
Correct.
And mind you, as we know, Zimbabwe has been having all this economic crisis of its own shock. And the only place that connects it to the outer world in terms of the ocean is either South Africa, or is Mozambique,
yes,
or Tanzania on this other side.
Yes.
And from my own experience, a lot of Zimbabweans used to come to Kariakoo, to Dar es Salaam, to buy things so that they can go to, they can take them to Zimbabwe. Yes. So economically, you can see it makes sense, but back to the two things. What about the mass testing? So yes, you're trying to save the economy, but are you doing mass testing in the borders, especially to make sure that you don't have, the borders don't turn to be hotspots? So when you're listening to the speech from Zambia, it makes sense because they've realized Nakonde now is becoming a hotspot. We need to close it temporarily. I have listened to the speech of the person who was giving the directive from the president. You could see it's a temporary measure to make sure that we are increasing. We are, number one, they are teaching again the health personnel to deal with the situation. They are trying to deploy and redeploy more people, more health workers. They are trying to get more PPE, protective equipment. So you can see it's a measure to contain and to be more systematic in dealing with the pandemic at that particular border. Otherwise, it will turn to a hotspot. And if it turns to the hotspot, the economy won't work. This economy, the cross-border economy won't work. So it goes back to that famous quotable quote from the president of Ghana. Of course, I'm paraphrasing it because I can't remember exact word. That you can revive the economy, but you can't revive or resurrect the people. Yes. But COVID is giving us a situation where you have to create a balance.
Yes.
Because indeed, if you close your economy, definitely the poor people, the marginalized who depend on their daily activities outside, they are going to suffer. Some of them are even going to die because of that. But at the same time, if you just leave your economy, almost like what they call, in Swahili, they call soko holela, like it's a pejorative for soko huria. So yeah. Soko huria is a free market, but it can turn out to be a soko holela. So you open your economy, but you don't have a systematic strategy to make sure that there's mass testing, there's some sort of a partial lockdown or control to make sure that that economy is sustained, it works, it creates a balance. And again, it's not supposed to be perfect because this thing is a big problem. Nobody can really handle it perfectly, but at least we need to get to that balance. And that's where I think the challenge comes in. And that's where the issue of Pan-Africanism, which people think is an idea, is just an ideal dream, but COVID is giving us an opportunity to see why people like Nyerere, Nkrumah, Nyerere from Professor Shivji Saida Othman and Waza Kamata's biography stood for when they were insisting that Africa must unite. Because what they really meant is that some of our problems, if we tackle them together, it becomes easier to tackle them. So it's quite possible our president, in his goodwill, said we can't close the border for the sake of our neighbors. But now, as some people in the social media are saying, at the end of the day, now it's our neighbors who are closing the border.
Yes.
So in order, so you have two statements, two countries or more than one countries, seeing that there's a mutual need for these borders to be open. But then how come we get to this point whereby the good intention of the opening the border end up not being so much of a good intention? It's simply because there is a need to have a joint strategy to do mass testing at the borders, to contain and control the spread of the virus, to flatten the curve, as some experts say. And initially we started very well. There were all these interministerial conversation between countries in East Africa. I don't know how far it has gone, but I saw there was a time we asked, somebody asked a question, our minister for health, she was asked a question on Twitter. When the initial number started to come, the initial number of cases of drivers in the Kenyan border, in the Ugandan Kenyan borders. And then they said, yeah, they have all this mechanism of updating each other, communicating. So it seems we started very well. So the question is what happened in between? And we can only know when they share the information publicly and when we have a joint strategy because of this interdependence.
Yes. If I may come to, there was quite a moving article or letter to the president of Tanzania, President Magufuli, that was published on a blog, Udadisi, just recently. It was a few days ago, and then it was republished in the Mail and Guardian in South Africa in English by Miss Mwanahamisi Singano, where she was appealing to the president. And clearly there is some discomfort, even within Tanzania, with this, perhaps this inconsistency in terms of approach. And I was wondering whether you can comment to that, because I felt that was a very heart-wrenching and heartfelt appeal by an articulate, patriotic citizen concerned about the direction Tanzania is taking vis-a-vis the fight against the COVID-19 virus.
Yeah, so that letter, I think personally, is one of the best letters or articles that Mwanahamisi has written on Udadisi. She's written a number of articles. All of them are nice and useful and important. But this one, for me, it was like, this was Mwanahamisi at her best. She had been going through a very emotionally wrenching situation, losing her relative. She actually lost another one afterwards.
Oh.
I'm not sure if they're connected or not. But managing to come to that level and calmness of trying to share her message in such a way that it could have an impact.
Yes.
Because she had an option, she could have simply just criticized and attacked, but she provided an analysis of the situation, a possible solution to the situation, and of course shared and expressed her emotions and her heart and her feeling, her position. And to me, what I found particularly interesting about that article, and it even helped me explain what I was saying earlier on about this style of our current president in terms of what seems to be very consistent in his approach to governance, style of governance, and what seems to be inconsistent. It also ties with another dichotomy that I prefer using when I'm trying to understand Tanzania and the polarization between people who are pro-government, people who are people called Mataga in Tanzania, make Tanzania great.
Yes.
So them is all support of the state no matter what. And then you have people on the other side who are critiquing the government no matter what. And somebody even referred to both camps as fundamentalists. And then you have people who are either in between, not necessarily in terms of position, not necessarily in terms of sitting in the fence, but just trying to make sense of what is really going on beyond this dichotomy. So I tend to see Tanzania as having pockets of authoritarianism, but at the same time having pockets of democracy. And they've been going hand in hand, and they predate the current regime. We've almost had all of them in all the 5 regimes.
Yes.
So when you look at the international media, and then they're telling you everything is just authoritarian, and then you look, how come they're that critical editorial? They're even in the Daily News back in the days in the Times. How come they're that critical article there during either the 2nd regime or the 3rd regime? So they've been going hand in hand. And in a way, this pocket of democracy is the one that helps shape some of the positive strides, which I think we should zero in or focus on them. And in a way, they fit to that element that may seem to be inconsistent in the way the current president governs, but maybe it's not inconsistent at all. Maybe the same person that we feel is so rigid is the same person who maybe sometimes listen and change his position. Because we have some cases even before coronavirus. And here we have one classical case where the state was barring people at night. It was not allowing people to bury people according to their normal cultural and religious practices, and maybe it was informed by science, maybe, but we are not told openly, so that people can get to own that strategy or that style that the government or the state was trying to use in dealing with the issue of burial. And then someone Mwanamisi comes and writes this article, and he talks about those cultural aspects of burial and religious aspects, how important they are. And he addresses it at a very personal level to the president. And we know the president reads from his speech, he seems to be reading social media. So I don't know, probably he indeed read it. And few days down the line, we're seeing a president critiquing his own state official, which again is also his style of governance.
Yes. So
it has been a consistent style of governance, or somewhere in a way he associates himself with some of the implementation or the interventions or style of some of his subordinates. That's a whole other new debate. Why does he do that? But at least it's a factual thing. So he questions logically why this particular leader said one of the leader who died could not be buried in their own place. And he made an interesting logical argument that if you can indeed, if the people who were attending to the COVID patient were using the PPE in a protective way to protect themselves, why don't they use the same PPE on that particular person and ensure that they take a body for burial in a place where his people, relative or people, will bury him according to their cultural standards and spiritual religious standards. And that was totally in line with what Mishi was trying to say. So for me, it's a proof that it is possible that there are some situations where the president can listen and make sense out of what we are saying, maybe especially when you say it in a way that is more constructive rather than closing the conversation from the get-go. And that's why some people say, if you come with a statement, the president is foolish, and then the next statement, Mr. President, please, can you do this? You've already said he's foolish, so why do you really expect him now to listen to you in the first place, you know? Or you come and say, yes, the president has a PhD in chemistry or science, but he's not scientific. The president is not scientific. And then you come and say, dear Mr. President, Honorable President, there is scientific measure. Can we please implement it? So sometimes maybe we need to go through the ABCs of advocacy and lobbying to try to change some of these things. I mean, I know there are moments where it just said to be hitting hard. But sometimes hitting hard, criticizing hard sometimes doesn't work. Sometimes you have to find some sort of a middle ground. You need to make people, to make things make sense to people. Probably some people, they only know about the total lockdown, zero lockdown. So maybe you need to make sense, you know, there's somewhere in between, a partial lockdown. You can do this. You can arrange the Kariakor market in this format or that format. We don't mean that close the whole of Dar es Salaam, but Dar es Salaam has got 4 main outlets. So maybe have some sort of massive testing in these spaces when people are coming in and out of Dar es Salaam. Maybe we need to find a way whereby people just don't go to Dar es Salaam to greet their people. Maybe they just go to Dar es Salaam to attend some urgent matter. There can always be some creative local way instead of simply wanting to copy and paste, as he says. So if we are bringing copy and paste models, and then you say no copy and paste models, and we're not even giving an alternative, context-based, African-centered, locally based solution, it will always be a tug of war, black and white, and we'll be just talking cross purpose. Nobody's listening to each other.
Thank you, Dr. Chambi Chachage, you know, from Tanzania, currently at Princeton. Thank you so much for giving us your time and your insights into what is happening in Tanzania that is the cause of a lot of chatter and concern. I'm sure we'll be speaking to you again. Kwa hivyo nasema asante sana, shukran, asante sana, and you stay safe in Princeton.
Asante, thank you.
Asante.